Hi everyone. So finally got the DVD in of my scan from March, and oh, the report really doesn't do it justice. I mean, I'm literally shocked at what some of the pictures I've seen. So anyway, this is starting at the head, and I like this one here because you can really see where the tumors are more accurately. But anyway, there's the first one here. You can see the little lytic part where it's actually destroying the bone there, and the spine's the C1 or C2 area there. And then C3, that's a new one. These are all lymph nodes. They're actually going to biopsy this one in a few days. I think it's just doing a needle biopsy, so it shouldn't be too big of a deal. A little bit of hypermetabolic activity with that. That's worrisome because it's a little thin there, but if you look on this side, it's also thin, so that might be normal. But you can see a lot of this hot activity. That's, potentially a lymph nodes, and this is the big top of the lungs here. That might be actually a new rib metastases. That looks like it's in between the ribs, more lymph nodes. Lots of lymph nodes. Okay, now that might be, that's in the muscle, or could be lymph nodes. That looks like it might actually be in the bone. That's another lymph node. More lymph nodes, and this is the sternum, so that's got a nice little tumor in it. You can see a little bit of hot spots in this vertebra here, but nothing serious yet. Still some in the sternum. Now here is the moderate pleural effusion in my left lung. Usually this would go all the way down here. Might be a little bit of like a little trace, but that's the most I've ever had. So, funny thing is I don't feel really terrible, but that looks a lot more terrible than it looks, I guess. But there's another little spinal tumor there. You can see the little blotches where the bone's been eaten away. More lymph nodes there. I'm not sure why this is kind of pale, but looks like soft tissue there. I don't see bone material. Now this is one that was not listed. This is on my scapula on the right side, so that's peculiar. I didn't know that was there. That was not listed. In fact, many of these were not listed in the report. It was very vague, so I wanted to see the DVD myself. Another one there. Another potentially small one there. I have to watch out. Could be something else. But now here, this is at the bottom of the lung. You can see there's some hypermetabolic activity. Now this could be what's contributing to my pain I'm having in my back. But there's a little, looks like a little rib metastases there. Potentially one there. There was a little bit of a hot spot there, but again, this is the liver. Looks pretty darn good. I like that. Kidneys, that's perfectly normal. Oh, now this is where it starts getting ugly. Okay, so I pass that up. This is like, holy crap. That means that this tumor has eaten into my spinal cord. So I'm surprised I'm not in massive pain, because that should be like infringing on my spinal cord, and that's scary. In the last 3 months, it really grew. I can't believe it grew this fast. It's never grown this fast, so definitely my medications have quit working completely. So anyway, that's something I have to really watch out. There looks like there might be a little one there. That's a soft tissue issue there. So I'll have to keep an eyeball on that. But this one's my most concerning one. I think that's T12, if I remember correctly. So yeah, not good. And a couple big hotspots, but you can see that they're just starting to eat the bone, so they hasn't completely destroyed the bone yet. A small lytic one there, eating the bone away. Okay, remember, this is normal stuff here, guys. This is just the kidneys doing their job. Although this is, I guess it could just be the little, that could be normal. Okay. Anyway, so yeah, there's another. You can see again, that's hollowed out bone. That's not good. Although that does look kind of weird. I don't know. I don't have to keep looking at other scans for that. Another little one there. And there's a little heat activity here, but it just could be, there's no guarantee what that is. Except for, though, that's pretty obvious. That is definitely a lytic tumor. Okay, so that actually looks like two little carbunkled ones there. Another one here now. If you compare the density of the bone here, it doesn't, I mean, the density, there's density bone here, but then you can see it is a little bit thinner right there. So this one is definitely thinning the bone in that area, and that's not very helpful. Another one here, if you compare this side to this side here, you know, it's definitely eating the bone, so that's not good. Alright, so another little hot spot up there. Some more hot spots here. Now, they said there's something up here. I mean, it's a little bit hot. That might be a little tumor, but it doesn't seem very, very active if it is. It seems like it's almost more the joint that's having issues. But again, I'm not really sure, so that's just my guess. There's a little activity there. It seems like that this scan was done while I was on prednisone, and I'm wondering if the prednisone had anything to do with why the cancer suddenly grew so fast. So anyway, there's one more image that might kind of give you an idea. This one here. It's really light. I haven't figured out how to make this one darker, but you can see all those little spots. Those are all supposedly tumors. A lot of these are, you know, it's really hard to tell in this one. It's not very dark. But you can see that's the bladder. That's normal. Kidneys, that's normal. And then it's not. It needs to be darker, but it's not. Anyway, you can see some of these hip ones here, and some of these spine ones here. Anyway, it almost looks as bad as it did when I first got diagnosed 4 years ago. So this is an indication it's definitely time to switch things up. But anyway, don't want to keep the video too long, but as I get more information,